Hello. Following a letter from your doctor, you will be contacted by the Clinical Measurement Department for a CPAP machine setup appointment. This is a face-to-face appointment and you will need to attend the department in person for a mask fitting, collect the CPAP machine and to be shown how your treatment works. At the appointment, the healthcare scientist will fit you with an appropriate mask. There are a variety of mask styles to choose from. If you breathe through your mouth most of the time, if you get breathless, if you get nasal congestion or sinus issues, then you will need a mask that goes over your nose and the mouth. This will allow you to breathe both through your nose and your mouth when you have the mask on. If you mainly breathe through your nose and don't have an issue with nasal congestion, then you will probably be able to manage a nasal mask. If you are particularly claustrophobic and don't like the thought of wearing a mask on your face, the smallest, least intrusive mask is a nasal pillow, which has cushions that plug into your nostrils with a simple band around the back of your head. Due to the way that CPAP works, by blowing a constant pressure of air, all masks need to be worn snugly, tight enough to form a seal around the face so minimal air escapes. All masks used for CPAP therapy have an intentional leak. This allows to vent the air that you breathe out to escape, and so it is normal to feel a gentle flow of air through the front of the mask. If your mask is leaking air which sounds loud enough to disturb your sleep, or is blowing into your eyes, then the mask requires some adjustment. Adjusting the Velcro on the straps by tightening it can help, of course, but it will depend on the style of mask that you have chose. Be cautious not to over-tighten your mask, as this can lead to skin irritations and sores, especially on the bridge of the nose where there is not much flesh. Over-tightening can also lead to an increase in the amount of leak as the cushion that sits on your face inflates with the pressure. If it is too tight, then the cushion cannot inflate effectively, affecting the seal on your face. All masks that we provide can be fitted comfortably, allowing the fingers to easily slide underneath the headgear on your cheek. A key to getting on well with CPAP is a good fitting, quiet mask. When you visit for your machine setup appointment, as well as being fitted with the most suitable mask, you will be shown your CPAP machine. You will be given all the equipment required to get started with using CPAP therapy, along with the information leaflets, instruction guides, and details of your first follow-up appointment. The treatment pressure will already be set based on your sleep study results and the severity of your CPAP apnea. The pressure is locked into the device and cannot easily be changed by mistake. We encourage you to take your equipment home and give it a go. Your follow-up phone call should be roughly within 2 weeks of collecting your equipment. At this appointment, you can ask questions and receive guidance from a healthcare scientist looking after your care to troubleshoot any issues which you may be experiencing when trying to use CPAP. The equipment is fairly easy to set up. You will need a bedside table of some sort to allow the machine to sit closely to the bed and a power socket close by. Plug the device into the wall, ensuring the cable is connected fully into the transformer and again into the back of the machine. There is only one hole where the power cable will fit. Make sure the power is switched on and the machine will automatically fire up. At first, it will bring up a message about reading an SD card. This is where it stores data about usage and how effective treatment is. After a few seconds, the message will go and the machine is ready to use. Connect the long tube to the hole on the machine, again the only place where it will fit. The long tube then connects to the mask. Your mask will either have an elbow or a short tube fixed to the mask. Either way, this is where the long tube fastens to the mask. To use CPAP treatment, we recommend fitting the mask first, connecting the long tube to the mask, and then turning on the pressure using the button on top. If you turn the pressure on first, it can be difficult to fit the mask with the air blowing through. We suggest when you first get it home to try CPAP in the daytime, just to become familiar with it. The treatment is designed to be used only when you are asleep, but it is a good idea to build up your confidence with it whilst awake first of all. It is common when first using CPAP to feel strange. The pressure is blowing at a constant rate, so it normally feels easier to breathe in, but a little harder to breathe out against resistance. The best thing to do is not to panic, sit with the mask on and the pressure blowing. Listen to some music or radio to distract yourself from your breathing. All CPAP machines have a ramp feature which can be turned on for comfort. This starts the pressure blowing at a very low rate and gradually builds up to the high treatment pressure over the length of time selected. This can be useful at the start of the night. Start the pressure on low, let it gradually build up over a 20-minute period, and by this time at full pressure you should have drifted off to sleep. If you wake in the night and find the pressure is too forceful, you can stop the therapy and restart it. The ramp will be on again, gradually building the pressure back up. The ramp can be as short as 5 minutes up to 45 minutes. You can set this yourself to your own personal preference. If you do not like the feel of gentle pressure, you can turn the ramp off altogether. Details of how to do this are in the machine manual. To get the most benefits from using CPAP, use it all night long whilst you are sleeping. We appreciate sleeping with a mask on can be difficult. The minimum length of time to use CPAP is at least 4 hours per night to get any long-term health benefits. CPAP is a treatment for obstructive sleep apnea, not a cure, and therefore it will only work on the nights it is used. We would like you to aim to use it for at least 4 hours every night, longer the better. To stop the pressure blowing, press the on-off button located on top of the device. The screen will show how many hours the therapy has been used overnight and how happy the machine has been with the level of mask leak. After a few seconds, the screen will dull down and the machine will go into standby mode. Please leave the device plugged in at the wall with the power switched on in the daytime. This means it will be ready to use again at the touch of a button at bedtime. The CPAP machine has a built-in modem which allows data to be sent through remotely to the hospital. The information that it sends includes the number of hours CPAP has been used for each night, how much the mask has leaked, and how often your airways have closed down whilst using CPAP therapy. The data sends through automatically using the mobile phone signal. This is why we ask you to keep the device plugged in to a power supply. Your data will not be looked at every day, but it can be brought up and studied during consultations or help troubleshoot. If your settings need amending, staff at the hospital can send this to your machine remotely without the need for you to attend. If you have any concerns regarding remote monitoring, please let a member of the CPAP team know at your appointment. Once you have taken your CPAP machine home, we would like you to try it and use it every night and feedback to us at your follow-up appointment. Mask fitting can be fiddly to start with, but it should get easier with practice. If you have any problems with dexterity or getting the hands to the top of your head, please raise these with the doctor prior to collecting your CPAP machine. If you have an oxygen concentrator at home and use long-term oxygen therapy, please let the team know. We can provide an adapter to allow the oxygen to be connected to the CPAP device if needed. A follow-up appointment will be made where you can speak to one of the healthcare scientists to discuss your progress with treatment. You will be asked some questions about the treatment, your symptoms and driving. Please answer honestly and the team will feed back to the sleep consultant if needed. Once you are established on treatment, the CPAP team will contact you once a year to see how you are getting on and replace any consumables that are required. It is also classed as an open appointment though, so if you are having any issues in the meantime, you can always book yourself in with the team. Clinical measurement contact details are included in the CPAP bag with your information leaflets. There is a phone number, email address and opening hours. The CPAP mask should last approximately 1 year if it's well looked after. Please make sure the part that touches your face is washed daily and the rest of the equipment, mask frame, headgear and tube are also washed regularly. All machines have a dust filter, which prevents excessive dust from entering the CPAP machine. These need to be checked and defluffed regularly, and they should be changed every 6 months. Clinical measurements will provide any spares if needed. CPAP treatment aims to improve the quality of your sleep. It is not classed as life-saving treatment, and therefore we do not have an out-of-hours number. If you need any support, please call or email us. If at any point you are concerned about your health, contact your doctor or dial 111 for advice. Thank you.